Welcome back to another insightful episode of Me and My Health Up. I'm your host, Anthony Hartcher. I'm a clinical nutritionist and lifestyle medicine specialist. The purpose of this podcast is to enhance and enlighten your well-being. And today we have a very special guest, like we always do. We have Dr. Jeffrey Gross, who's a neurosurgeon, and he's a medical professional, embraced medicine, went out and practiced, and then realized that for many years of treating his clients with drugs and surgery, he thought there's got to be a better approach. There's got to be a new cutting edge way to do medicine. So he went back to school and retrained in regenerative medicine. So yes, we're talking about regenerative medicine. So this is also known as stem cells. So it basically essentially enhancing the way in which our stem cells work in our bodies and making them more effective, actually doing the task that they're designed to do, which is regenerative. So what we have, inflammation, we have aging, we have a degenerative process, and a lot of these health conditions that we experience are a result of a degenerating process. We call it inflammageing. And so the longevity movement is all about biohacking and about reducing that inflammageing, and stem cells is a way of doing this. And we get into what is it about stem cells, how they work, who is it for, and it's for those out there with ailments that don't want surgery. Again, it's not going to prevent all surgery, but for things like knee operations, it can really, or a spinal operation. So Dr. Jeffrey Gross uses it for spinal surgery as a alternative, as an option for his clients. But obviously he assesses what is going to be best for his clients in front of him based on what is the need and what he can do to help that client. But stem cell replacements therapy is a fantastic, it's not really replacement therapy, it is actually helping your stem cells work better. So it's an intravenous way. Dr. Jeffrey Gross is the expert. He's going to be sharing more about this. And so without much further ado, I'd love to welcome you into this episode on regenerative medicine with Dr. Jeffrey Gross. Welcome on the Me and My Health Up podcast. Dr. Jeffrey Gross, how are you doing today?
Very well. Thank you for having me.
Such a delight to have you on. I really love what you have in LinkedIn in terms of the stem cell whisperer. So we're certainly going to be digging into a bit more about that and finding on, more about regenerative medicine. I haven't had a guest on the show that's spoken to regenerative medicine. We've certainly had guests on the show talking about longevity and some biohacks around longevity, but we haven't had anyone talk about stem cells. So this is a new insight for the listeners of Me and My Health Up. So really appreciate you coming on.
Thank you. Appreciate it. And looking forward to sharing.
Oh, fantastic. I always start with this one question that the listeners are very familiar with, is how you've arrived at what you're doing today.
Well, I'll try to give a shortened version, but I trained in traditional medicine after having bachelor's work in molecular biology and biochemistry. And when you sort of go down this funnel into clinical medicine and you're treating patients, and I've had over 25-year career in practicing, traditional medicine. You sort of miss that science. That nerdy part of me misses the cellular science, and a lot's happened in the time since I have that undergraduate degree. So I was compelled to go back and relearn that and its updated material because I was frustrated. My patients were frustrated because I treated a lot of spines, and I went into regenerative medicine because of my patients who didn't want these big open surgeries, but they had an ailment that was still plaguing them. They wanted something in between there. So I went back to help find that, and we've been very happy to help fill that.
So your specialty is neurosurgery, is that right?
Right. Well, I would say it was my first specialty.
And now you've upgraded.
Right.
Yeah.
I guess I'm dual now. So I still see my patients with spinal problems and that kind of thing. But now going into regenerative medicine over the last 5 years, I've blossomed into various aspects of what stem cells and their related biologics can do, whether it's longevity medicine, anti-aging, biohacking, and now treating other parts besides the spine.
Yeah, so let's get into regenerative medicine, and talking about stem cells and how that type of approach can really help. Well, first of all, let's find out who it's for. Obviously, it's helping your spinal patients, but who else is it for?
Well, I would say most commonly, at least in my own office, we see patients with mechanical joint problems. So, not just the spine, but a lot of knee patients, shoulders, athletes, overuse syndromes, people who have wear and tear, or what's sometimes called bone on bone, or what we doctors call osteoarthritis, people trying to avoid a knee replacement, perhaps. These are perfect candidates to try something else first. I'd say the second group is dealing with something more involving the organ systems, whether it's type 2 diabetes or some other problem that has an inflammatory nature. And all the word inflammation or inflammatory is it's kind of a little bit vague. We know that word in response to a bee sting or an infection or a cut or something like this. But really, inflammatory programming is of a cell is a degenerative, deteriorating programming. It's an aging programming. Someone wise combined the words inflammation and aging, called it inflammaging. You may have heard that because you've had other guests in the longevity side. So anything we do on the regenerative side is working against that inflammatory cell programming, flipping the cell activity into restorative, healing, more youthful mode.
And so it's that inflammation that's really not really allowing the regeneration process to happen, and the cells regressing as a result of not regenerating.
Correct. We're either degenerating slowly, or in some cases more rapidly, or we are regenerating. The cells have one way or the other. It's kind of like our metabolism. When we eat, we're storing. We eat sugar and insulin, and we're storing, or we're burning. There's really no in between. There's no middle ground. You're flipping one way or the other.
So, in terms of this regenerative approach, is it because of this Western lifestyle that's really sort of, I guess, stopping our system from doing what it should be doing?
In part, yes. I mean, we are exposed to so many man-made chemicals and electromagnetic forces and physical wear and tear and psychological stresses. Now, some of these things existed when we were prehistoric or cavemen, but certainly we are exposed to so many cellular stresses, and those are threats to our cells, and the body's and the cell's responses to threat is inflammation. It's a defense mechanism. The problem is we're so busy defending ourselves that we can't heal as well as we did when we were younger, or many generations ago. So that I would say that in part that is the cause. The other part is we are not so naturally based anymore. We are not eating like we should, organically as we could, and it's just very difficult to avoid pollutions and toxins and things in our water that some of them we probably don't even know about.
And in terms of they talk about first line of therapy, second line of therapy, and that, where do you see the stem cell or regenerative medicine therapy fitting into what people should be looking at? Should they be looking at, first of all, addressing their lifestyle and what they can, or do they do it in parallel? What do you recommend to your clients around this?
I agree with where your question's taking us, and where it's taking us is if we make all the right changes and try to get back to the earth and the organics and a version of dangerous things in our life, we'd be doing ourselves a favor. That's called epigenetics. And you're born with your genetics, you have your genes, but what genes are active and being used and influenced in the cell determine a lot, and that can be from how you eat and how you sleep and how you breathe and what air you breathe and all these things. So plus, if I were to help someone with stem cell type medicine, if their body is exposed to cigarettes and alcohol and too many bad things, I'm really putting these biologics in a bad environment. They're not going to do well, so it's almost not worth it. So if we're talking about longevity and health and doing the right thing for a person, I agree with you that the first line thing to do is get your house in order.
How fantastic. I'm glad we're on the same page. You're certainly talking to the listeners of Me and My Health Up. So really keen to, and obviously there's various factors that would encourage someone to go and seek stem cell, therapy as opposed to having surgery, because it's probably it's that next level in a sense that it's not so invasive as surgery, right?
Right.
It's less invasive than normal surgery. Well, there's a level of invasiveness, but if you could just talk, if you could just talk through, I guess, what it is and how it works.
Sure. So, I group things into two main categories of approach. The one is systemic. So, if we're dealing with system disease or inflammation, it's usually intravenous. So, it's a needle. If it's more directed to a specific spot or spots, like a knee problem or something like that, it's a needle. It's a direct injection. So, really, we can't do much topically. Stem cells and exosomes and other biologics just don't penetrate the skin well. Our skin is an amazing barrier, so we really don't do much topically. I have done some eye drops and we have some breathing, some inhalational things for people with inflammatory lung conditions, but the vast majority are injected in some form.
And in terms of where they're coming from, are they coming from the person that is seeking the surgery, or are they coming from? Because I know that you've gone into a special area, so if you could just share with the listeners about your unique approach to stem cell therapy, how it's different, and what are the benefits in doing your specialty around this.
Sure, and my approach isn't unique. I stand on the shoulders of giants and others who have done this before me. But there are two main sources of biologics, and stem cells may be biologics, exosomes may be biologics, and those are yourself, because we're using our own every day, and someone else's. So I'm 57. If I take my 57-year-old stem cells and re-inject them in myself, they act as if they're 57. I'm looking for some youthful source of healing. If I can go off script here for a minute, and you think about a 3-year-old who skins his knee on the sidewalk, and he cries, mother kisses it, puts some antiseptic on it. Here's your bandage. Go about your way. 3 days later, the band-aid falls off in the bath, and the scab is almost completely healed. And I know if I scrape myself, it's 2 weeks later, it's still healing. I want to heal like that 3-year-old, and the best way to do it is to get some of that younger biologics. Well, we don't want to harvest from a 3-year-old; they don't like that. But it turns out there's some what used to be considered medical waste that we can now have donated, and that comes from perinatal source. So a mother delivers a baby by C-section, and instead of throwing away the placenta and the umbilical cord and the amniotic fluid, that's treasure now. It used to be trash. Now it's treasure. It's taken, it's processed in a sterile lab. It is screened and tested to make sure it's free of disease. And that can then be reused in the aspect where we're trying to appeal to people who need youthful healing growth factors. It's like revved up stem cell activation.
Absolutely. I could totally relate to what you're saying in terms of that 3-year-old example, having children myself and seeing how quickly they heal. And it's phenomenal how quickly they bounce back. And it's in terms of, you mentioned in terms of, grabbing that embryological fluid and the placenta and working with that. And there's a sterilization process. Is there any risk to the patient when this is injected in them, that it may not be completely sterile, or that risk has been taken away?
Well, we only work with labs that are compliant with our, federal rules. It's the FDA here in the States. I'm sure there are parallel organizations elsewhere. So it has to go through certain sterility process, certain screening process. and each one is tracked by a lot number. Nothing's 100%, right? This is all a 99.9% situation. There has been an issue in the past in a particular lab, and there was a group in one of our states called Nebraska that went through a series of infections. So these processes improve all the time. But that's also no different than any pharmaceutical that you might take, or a knee implant you might have, or food you might eat that could be tainted with E. coli. We have risks everywhere around us. So the processes and the requirements are improving all the time.
And is this treatment facilitated in a hospital, or can it be done in a doctor's surgery, or where's it facilitated?
So, a lot of the IVs and the very simple injections we can do here in the office under, clean conditions, antiseptics, what have you. When I do some of the joint work, I'm following a process of the French, who have over 15-year follow-up with joint restoration. And instead of injecting the joint, they inject the bone just above and below the joint, because that's where the stem cells are that need to be reinvigorated to deposit, produce, and really regenerate that cartilage-based joint. So because no one likes bone injections, we do tend to do those at a local surgery facility. It's not a hospital. It's a clean room. It's got an x-ray guidance. We do a light sedation, little twilight. So it takes me 10, 15 minutes, and then the patients enjoy that a little bit better.
So it's not like a hospital, where you're going in for day surgery or night surgery, not like that experience.
We call them here in the States, we call them surgery centers. Basically, people go in there for injections or very minor procedures where they can have administered sedation or anesthesia, and they can recover the patient. No one's planning to stay there. It's not a hospital. It's not an overnight deal.
Yeah. Okay. And earlier you mentioned in terms of this can be really helpful for autoimmune conditions. And I'm just thinking from that risk element, when you're injecting someone else's stem cells, is there a risk there that body may attack that stem cell and may reject it? Is that a risk in this?
So it's a great question. Theoretically, yes. As it turns out, though, we don't see that in practice, because the stem cells or the other biologics tend to be what's called immunomodulatory. They temper the immune system. So one can't necessarily have that, exaggerated immune response. So that's why we find it very anti-inflammatory as an approach. And that's why it's so good in dealing with diseases that have an inflammatory component, which include most of the diseases of aging, since aging is really accumulated inflammation. Yeah. So autoimmune diseases are great. If you're attacking your thyroid or you're attacking your joints because you have some type of arthritis, then these IV approaches are ideal. We don't see any rejection. We do, interestingly, see a very temporary flu-like response. And if you think about it, when you have a flu illness, you ache everywhere, your joints hurt. It's because you've accumulated all these inflammatory proteins and cytokines and little chemicals. So what's happening is, if your body has a buildup of all these inflammatory proteins, this approach with the stem cell-based biologics causes the cells to release that. You feel achy as they're leaving your body. They're accumulating for a bit. So we have, for example, people with Lyme's disease who have significant inflammation, and they have a significant flu response for a number of days after. Then they feel better.
And it's going to be a case by case depending on your age and what condition you've been treated for. I guess that period of treatment phase, I assume it's not a one-off injection. Anyway, I'm not sure, but what's the process for a client? Just say if they're coming in they got type 2 diabetes, and you're thinking, well, maybe we can, heal the pancreas or support the pancreas, and you're going to work from that. What's the period of time you'd work with them?
Well, actually, I would like it to be a one-off injection. Are we curing or healing, or are we just resetting the inflammatory burden back a number of years, and we just wait until we need to maybe approach it again? It's not clear. And you're right, it does start with how healthy someone is to begin with. But we don't look to do multiple treatments if they're not necessary. We look to do one good one and measure the response. And so far, my clients with problems who have had some type of approach from exosomes or stem cell activation have not needed additional care. Now, I've only been doing this, up to 5 years. So I don't have a 10 or 15-year longevity. But if you look at the literature, particularly the French literature I referenced, they have over 15-year follow-up in their knee study with the bone injections. Only 15%, give or take, of clients needed then to be reevaluated for a problem. So 85% at 15 years, to me, that's fantastic.
And so I'm just thinking in terms of once the stem cells are administered, it's then the healing process takes place with the bodies or the stem cells doing their work, differentiating, becoming what they need to in order to do that repair work. And so it's really up to that person's ability to, well, I guess if they're also doing things in conjunction with that therapy that supports healing, such as getting restorative sleep, you mentioned, or eating good nourishing foods, organic foods, and breathing fresh air and all that. So that's also going to help that process of that bone recovery, or is that right in terms of?
Yeah, I mean, there's a lot more to it in a complex way. A stem cell delivery is actually activating someone's own stem cells through cell-to-cell communication, exosomes. It starts a period of regeneration. Now, that doesn't last forever, but if it regenerates enough of whatever is needed, for example, pancreatic islet cells or cartilage in a joint, then you can restore back enough function to remove whatever symptoms. That doesn't mean you then go about your normal, stress on your knee joint and then over time you're wearing it down again, of course. But, if you have a solution, you can apply it again when needed down the line.
Okay, so it's activating that person's stem cells, but I'm just a bit confused in terms of when we spoke about before about why would you inject? So those stem cells, those younger stem cells, communicate to the older stem cells to perform like a younger stem cell. In terms of its different. Yep.
That's exactly right. When you receive a stem cell delivery, you receive those cells don't last long, but they do communicate with your own stem cells and your own cells, and they reinvigorate the pathways and they activate the stem cells to also give off more of these cell-to-cell communication packets called extracellular vesicles, or I've been using the word exosomes, which is one way to refer to them. And when I was mentioning earlier, I like to use the word stem cell biologics because we can skip that stem cell step, say that 10 times fast. We can skip that step and go right to the exosomes. Exosomes can be made available by these labs, and they can be concentrated and delivered instead of stem cells. And we like that because they have no cells, there's no DNA you're receiving, and they do the same job, if not more efficaciously, than a stem cell delivery. So I'm a big fan now of sort of the next step in stem cell biologics, which is extracellular vesicles.
I was going to ask you, what is the future of stem cells or regenerative medicine? Where is it heading? And I guess you've answered that.
Well, I think that's part of the present. Where it's heading would be designer exosomes. Exosomes where we can stuff the cargo with additional growth factors or specific proteins that help the pancreas better than some generic exosome. So that's coming. There are already people working on that. There was a paper in the last year for cosmetic purposes. It's coming. There'll be weight loss exosomes. And the other beauty about the exosomes, if I can insert an advertisement for exosomes, is they cross the blood-brain barrier. So if you have Parkinson's disease, which does have an inflammatory component, if you have Alzheimer's disease, which has an inflammatory component, if you have other types of neurologic inflammation, what some people might call a leaky blood-brain barrier, exosomes will get there. Stem cells do not cross very well. They're too big. So I'm a bigger fan of exosomes, particularly of the nervous system. When I have patients with spinal cord neuropathic pain, we like to use the exosomes for that reason, because we can deliver them intravenous. I don't have to do a spinal tap to deliver them. Nobody likes a spinal tap if you can avoid it.
Totally understand. It doesn't sound all that, and how can the listeners best connect with you if they're thinking, well, wow, I really like the sound of this. It sounds a lot better than getting knee surgery or hip surgery, or So how can they best connect with you?
Sure. I mean, we're available on all the social channels, and we have a website. My company is called Recelebrate because we are reactivating your own cells, and that's spelled ReCellebrate. And you can go to recelebrate.com. You can find us on TikTok. I put out some little informational shorts, and Instagram, all the fun channels out there. And yeah, reach out to us, send us a message. We do like to educate people and talk, and we can do it through the magic of video conferencing like this, and help give people direction on what their options are. Because for so many years, as a traditional doctor, I didn't give people regenerative medicine options because I wasn't trained to, and now I can, and I'm very happy about that.
And just in terms of wrapping up this episode, we're seeing a lot of cardiometabolic diseases, and you mentioned one earlier, type 2 diabetes, and now there's some drugs out there in the market that are really helping people achieve rapid weight loss, but they got to keep injecting the drug for that to work. And just like with any drug, it needs to be applied and continually applied. Is this a real game changer in terms of addressing that rising tide of type 2 diabetes? Is this really the way in which clients with type 2 diabetes should be looking at addressing their type 2 diabetes?
The best treatment for type 2 diabetes is to prevent it, and that can be through not only diet and good lifestyle, but removing a lot of the pesticides and other things that affect our insulin sensitivity that are in our environment that aren't our fault. Not all type 2 diabetes is self-inflicted. However, I am a fan of the peptide based therapies. So, peptides are small proteins. Semaglutide, for example, which is one of the weight loss injectables, we call it a drug, but it's really a peptide that's part of glucagon. It binds the glucagon receptor. So, it's biologic. It's almost a biologic. It's a designer biologic. And, injecting is tedious, and you have to become, used to it, but it's a once a week injection. It's a great way to get the pounds off and reverse type 2 diabetes. I don't think that currently there's a stem cell biologic that's directly useful for weight loss, although I'm sure designer exosomes are coming to do that. I think what we're really asking here is there a stem cell or exosome approach to better metabolism? The answer is probably yes, but that might be the cheating way to get there.
So get back to the basics is what you're saying. Get back to the
Yeah.
fundamentals.
And I'm a big fan of semaglutide. So if you need that to get to where you need to go, get there. It's not so much a pharmaceutical like some of the man-made synthetic things are. Even though this is somewhat synthetic, it's a biologic. It's a biomimetic. It's used to bind a receptor that's giving us trouble. So if you bind that glucagon receptor and lose weight, it's a great way to get down there. That doesn't mean now you can go have all the bad food that you used to have. You still got to make the right epigenetic lifestyle changes and get your house in order.
And that's what you said before. Even with regenerative medicine, it's doing both in parallel is where the optimal health or the longevity is really going to come.
Absolutely.
Yeah. And do you have any concluding words for the listeners in wrapping up this episode?
Yes. Sleep right, breathe right, eat in a restricted time window. Make sure you get your protein. Longevity is associated with muscle mass and bone density. Weight-bearing exercise is the best way to reduce inflammation without regenerative medicine. It's also the best way to prevent dementia. Weight bearing would be, walking, jogging, running, lifting weights. They don't have to be heavy. You can mix it up during the week. A little bit of cardio, a little bit of weightlifting. It doesn't have to be be a burden. You can make it fun, and every day, and that will give you extra years of life and prevent you from needing to, have a knee replacement anyway.
Thank you so much, Dr. Jeffrey Gross. Really appreciate you coming on the show, sharing your wisdom with the Me and My Health Up listeners.
Happy to be here. Thank you again.
And to the listeners, thank you for tuning in to another insightful episode of Me and My Health Up. Stay tuned in for more insightful episodes. And for those that you know out there that are looking for potentially avoiding surgery, or looking at a knee replacement, or an athlete that wants to get back on track quicker, then please share this episode with them. It's certainly a great alternative to what else is out there, and could be what really is right for them. And they could reach out to Dr. Jeffrey Gross and see whether it's the right thing for what they want to treat and heal ultimately. So thanks for tuning in, and share it with others. Podcast disclaimer. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or professional advice and are provided for general information purposes only. All care is taken in the preparation of the information in this podcast. Connected Wellness Proprietary Limited, operating under the brand Me and My Health Up, does not make any representations or give any warranties about its accuracy, reliability, completeness, or suitability for any particular purpose. This podcast and any information, advice, opinions, or statements within it are not to be used as a substitute for professional, medical, psychological, psychiatric, or any other mental health care or healthcare in general. Me and My Health Up recommends you seek the advice of a doctor or qualified health provider with any questions you may have regarding a medical condition. Inform your doctor of any changes that you may to your lifestyle and discuss these with your doctor. Do not disregard medical advice or delay visiting a medical professional because of something you hear in this podcast. This podcast has been carefully prepared on the basis of current information. Changes in circumstances after publication may affect the accuracy of this information. To the maximum extent permitted by the law, Me and My Health Up disclaims any such representations or warranties to the completeness, accuracy, merchantability, or fitness for purpose of this podcast, and will not be liable for any expenses, losses, damages incurred, indirect or consequential damages, or costs that may be incurred as a result of the information being inaccurate or incomplete in any way and for any reason. No part of this podcast can be reproduced, redistributed, published, copied, or duplicated in a form without prior permission of Me and My Health Up.